Welcome back to another episode of Change Talk. As promised, today we're going to talk about internal family systems, cognitive distortions, and irrational beliefs. Before we get started, it's important to first convey that today's discussion is not meant to be an extensive explanation and is simply an elementary introduction to these topics. This video is only intended to highlight the common parts of these modalities, since today we only have a small window of time to cram all this stuff in. With that said, there's Larry, a troubled youth with his pants almost to the floor. He has been in and out of residential programs for most of his life due to several major larcenies, and every other word out of his mouth is some sort of profanity and is known to lie to almost everyone for the most trivial matters. What do you think is going on in this situation? Well, I hate to break it to you. We don't come into this world saying to ourselves that we're going to be social deviants or be resistant to change. However, that outcome is exactly what happens for some people. The question is why? Let's take a step back for a second. Forget all the contextual stuff like the baggy pants, backwards clothing apparel, pathological lying, and the potty mouth. What do we really have? Yes, this requires getting down to the basics. Remember, it's easy to get lost in the content of what is transpiring, and hence lose sight of what is really going on. What do we know for sure? We know that most other residential programs have tough kids that can be seen as potential threats. We also know that there is a very strong probability that this child is acting the way he or she is in order to convey the image of toughness. But why try so hard to have such a rough exterior? Why hurt the very people that are trying to help you? Why lose your credibility? Sabotaging yourself even before you begin seems like insanity to some, but those are the people that have no clue of what Larry's trying to achieve. And that's simply survival. Dr. Richard Schwartz, the creator of internal family systems, would refer to many of these similar behaviors as reflecting towards keeping our exile at a distance. An exile can be anything we don't want people to find out, don't want to acknowledge ourselves, or don't want to remember. So, if I'm acting like a gangster, spitting or rapping out my tunes, it must be pretty obvious that this child is putting on an act, since he wouldn't be doing this if he was by himself. If he is, then we need to get this on video. But who is this performance for? And what type of mask is he wearing during this performance? Typically, people that feel insecure tend to exhibit the very thing they tend to be lacking. In this case, an argument for security and self-esteem can be made. I know what you're thinking. Doesn't a kid that challenges an adult or a staff member have way too much self-esteem? The answer to this question is no. A person that has a strong personality and a belief in themselves typically thinks for themselves and stands true to their own value system. Those that have no identity typically attempt to blend in or appear standoffish for survival purposes. So, in this case, the exile could be that Larry is a scared 14-year-old boy with no strong attachment to anyone, literally believing that most staff members he has come across over the years has betrayed or left him to fend for himself. In a place full of other children that have a eat or be eaten attitude, this child has no clue that if he falls asleep, someone is going to steal his designer shoes. And if he wakes up the next day, he knows all too well that there's no one out there that's looking forward to either seeing him or believes in him. With this mindset, what does a scared little 14 going on 8-year-old boy do? This is where the manager takes over. A manager is the part of ourselves that is the first line of defense towards not letting the exile out. This could be the use of profanity or deviant behavior that the child manifests in order to keep prying staff at a distance and blending in with other children that can cause them physical or emotional harm. If I'm constantly rude to staff, then staff will continue to keep their distance. And there is no chance for the real scared me to come out, which I promised myself would never happen. How about those times when I got really close to a child in a residential setting? What do you think happened? A rehabilitation crisis or situation occurs that purposely sabotages our previous efforts and is commonplace for children like these. This could take the form of something small, where the child purposely, on a home visit, takes illicit substances, knowing the consequences upon their return, either to chemically wipe out the pain, or to secure the possibility that they won't go home to their abusive family again for the next month due to the 30-day restriction. Another example is that staff member could develop a close professional relationship to another resident, and this resident, like Larry, for instance, decides to start breaking large panes of glass, knowing that you would have to call the police and send the child to a higher level of care facility. Not coming from personal experience. When something like this happens and the firefighter or reactive part of ourselves takes over, it is usually a last-ditch attempt to prevent that part of ourselves that we don't like from surfacing. How about some less dramatic day-to-day ways of pushing back the exile? Aaron Beck, who is considered one of the founding fathers of cognitive behavioral therapy, also known as CBT, believed that there are many lies in which we tell ourselves, both consciously and unconsciously. These fallacies often lead to a diminished sense of self, feelings of futility, and are often contributing factors to depression, anxiety, and anger. These negative beliefs are sort of like suppression, blocking various attempts our minds take to protect themselves through distorting the truth. By simply identifying some of these common core beliefs, this ability will help you let go of many constructs that are holding you back. One common way we can understand this is by starting with understanding polarized or black and white thinking. I believe two of the reasons these distortions or inaccurate thinking exists is due to our culture and the excessive need for efficiency. Black and white thinking makes it easy to understand a complex subject, and its principles encompasses many aspects of our lives, from the examinations we are given in school to the very laws we follow from day to day. There generally are no shades of gray in the minds of people who think this way. They are the type of people that say all or nothing, always or never, or hyper-focus on one of the many possible causalities of a current predicament. Remember, like in Star Wars, only a Sith deals in absolutes, and is the path to the dark side. Too much thinking in this capacity generally makes a person extremely judgmental of other people, and eventually, like I said in other videos, that finger turns to themselves. And they will usually find themselves lacking in the self-compassion area. Personalization, despite being rarely spoken about, is another common human defect. This is when we tend to make something all about us. I bet you know some of those people. An extreme example would be a person with borderline personality disorder. Typically, one of the more visible characteristics for a person like this is that they typically misread subtle nuances of verbal and nonverbal communication through a hostile filter. For instance, you look at a person laugh while looking in your direction, and then look back down at their cell phone. To someone like you and me, we might think that they may have been laughing at us, but then realize the 1001 other possibilities, that it most likely had to do with someone else. Perhaps they even looked past us. Maybe we looked like someone they knew, etc., etc. For a person with personalization issues, they may believe that this person was laughing directly at them in order to be malicious and respond in kind. Next, the fallacy of fairness is perhaps one of those plagues that corrupt many of my depressed clients. Although you will hear me say on a regular basis that we should seek balance in our lives, I'm usually talking about time and resource management. This does not mean we should believe that an eye for an eye will ever be within our reach, nor that karma will catch up with the person that's wronged us. Let's face it, in our society, those that get caught committing a crime generally have done a similar crime several times before, without getting caught. Innocent people have been sentenced to life in prison, and medical malpractice is probably covered up more than you know. The top 1% will never pay their fair share of taxes, and that person that cuts you in the line at DMV probably cut someone else in traffic to get here. The principle of equality and fairness are generally seen as constructs of the affluent and sheltered. The person down the street from you that you know will give you the shirt off their back is likely to have another set of principles than a public defender or stockbroker that deals in absolutions. The realists are the ones that truly know what it means to suffer and quickly learn that they can either become victims of their misfortune or find strength and individuality through their scars instead of festering on retaliation or retribution of the person that has wronged them. Lastly, filtering is perhaps the most common cognitive distortion of them all. Let's say that you are trying to stop drinking alcohol. You give it a good go, and then with the help of your therapist and your peer support group, you had an awesome 3 months of sobriety. Then one night, after hearing that your boss is reducing your hours at work, you become depressed. One thing leads to another during that downward spiral of thinking, and you crack open a couple of those large 16-ounce beers, and you show up the next day to your therapy appointment, defeated, saying to him or her, "I relapsed," when your clinician asked how your week was. Mind you, the therapist asked how your week was, and the "I relapsed" statement represented 2 hours of a 7-day period. This isn't even counting your 3 months of sobriety that you worked so hard to achieve. However, in a single sentence, this hard-working individual who has made so many sacrifices to make it this far erases all of that hard work in a single sentence. Ironically, one could also argue that it was the same filtering style of thinking that led this person towards thinking that he might have to find another job, and that this hour reduction was going to last for weeks, which initiated this whole mess of wanting a quick escape to begin with. The last part of this segment covers self-defense mechanisms, or psychological shielding that we use again to numb ourselves towards experiencing the true gravity of our situation. Some self-defense mechanisms don't need to be explained, such as regression, compensation, and undoing. Now that I understand what these 3 terms mean, I guess this means that I have to return the jet ski that I bought after cheating on my wife, thinking that it might bring us together, attempting to return to our teenage years when we first started dating. Okay, that might be a lie. Notice how I used all of the 3 just now. How about some of the more common mechanisms that we may not know about? Intellectualization is a not-so-silent killer in relationships. These are the type of people that tend to use logic or stories to either distract or enlarge themselves. Most of the time, these intellectuals are seen as cold and narcissistic. In reality, they attempt to use logic to detach from their feelings as a proactive measure of what is usually previous trauma or feelings of inferiority. Notice how inferiority and trauma can both be exile concepts. How about the class clown in high school or that child with ADHD that is constantly changing the subject? Deflection is another common technique our psyche uses to kick the proverbial can down the road and not let anything get close to us. Sublimation, however, is perhaps one of the few mechanisms that can actually be productive if used in the right context. Good examples would be professions we tend to get ourselves into that take a once socially unacceptable trait and make it into a socially acceptable one. People that like to gamble become those stockbrokers you heard me talking about. Someone that is prone to violence becomes a professional boxer. And those deflective people tend to make really good comedians or comic actors. The last one of many that we're going to go over is reaction formation. This generally becomes exacerbated when we are dealing with a person in a position of power over us and have little time to think or react. So you don't like your boss working you to death, looking over your most recent promotion, telling other coworkers that he thinks you're lazy, and eventually one day asks you, "So Nancy, do you have any suggestions for improving this office?" You respond by stating, "No, Jim, you're doing great. Thanks for asking me. I can't think of a single thing I'd like to change around here." Boy, how many times has this happened to you? This is another defense mechanism that can be beneficial towards saving your job, people. Alright, so we only covered a select few common self-defense mechanisms and cognitive distortions today. But trust me when I say there are much more of them. The next video we'll be airing is going to be a little risky. If you have a history of trauma, you'll want to consult your mental health professional before watching our next episode on a single but perhaps all too common diagnosis out there: post-traumatic stress disorder. This video is likely to evoke deep and conflicting emotions and is definitely not suitable for some viewers. See you next time, and keep change a-comin'. Thanks for watching.